I'm Bill Dome, speaking for the American Academy for Oral Systemic Health, AAOSH. I'm here on the motor vessel activated O with Marty Jablow, general dentist from New Jersey, who also does a lot of consulting for a number of dental companies. We're going to be talking today about ozone in the era of coronavirus. And my attempt here is to do two things: to speak to those who are already using ozone and to those who may not be yet using ozone. However, most of my comments are going to be focused on those who are already using ozone. I really don't think that you can immediately go out and purchase a bunch of equipment and start using it safely. However, there are a number of things that you can do, especially using ozonated oils, that I think are very safe and that people can do almost instantaneously as soon as you get your hands on some. So let's delve into that in some degree. I'm going to start with ozonated oils because it's very hard to screw things up using ozone oils. We call them ozone oils, incidentally, because these are organic oils like olive oil that have been ozonated. There's no ozone, however, in these oils. Once we've made them, what's left is ozonides. And what you see here is kind of a cream, sort of a chapstick consistency cream that can be used in many ways in the dental office and is very applicable in the era of coronavirus. Number one, as a preventative, I would put some of this oil in my nose. And so poor Marty is going to be Mikey today, and we're going to have him apply the ozone oils. Generally, you put it right in the introitus of the nares, and then secondarily put it way high up, as far as you can reach. Ta-da. Now, why use ozone at all? Because ozone kills everything. It kills bacteria, fungi, and particularly viruses. There's nothing that we know of that's resistant to ozone oils. If the ozone gets to them, the ozone will kill them. It dissolves them. It breaks them apart completely. That means that although we don't know specifically what it's going to do with coronavirus, the likelihood is extremely high that if we can get the oils there, the viruses can't take rest and start to attack the mucosal tissues. So that's number one. Now, how did that feel when you applied it?
It's very simple to do. You just take some, apply it, run it around the inside of your nostril, and then you can stick it up higher, which it's a weird feeling if you've never had that done. It's going to be a lot easier than that coronavirus test, though.
Oh, yeah.
Much I can tell you. So you just put it in. It's got a little aroma to it, but nothing bad, and you could just go about your day.
As time goes on, you may taste it coming down the back of the throat. It's perfectly fine to swallow it. The other thing is that once in a while people will complain that these oils might burn a bit. If that's the case, and I'm not suggesting that you automatically do this, take a little bit of the oil, mix it with some of the base oil, like just plain straight olive oil, and then apply it and dilute it down, because even diluted is going to be plenty strong to kill viruses.
And it just takes seconds to do this. It's a very simple procedure.
I would do that a few times a day whenever you get around to it. You can't do too much. Now, the other question is, can I apply it and then stick the Q-tip back in the oil to get some more? Yes, you can. And the reason is that nothing lives in this oil. I don't care what you put in here, it's not going to survive. Or I suppose if it does, it deserves to. But if you don't like that idea, take a bit of the oil initially with your clean Q-tip, put it on the back of your hand, and use that as the dispensing surface to get more.
Think of it like chips and dip. You don't want to double dip. It's just not worth it.
Yeah. But my sense is that even though that's certainly the polite way of doing it, it's not really necessary in this case. And everybody should have their own little vial to carry around. And you can dispense this out. You don't need a gallon of this stuff. This is going to last weeks normally. And you could give your patients even some of the oils in a little condiment cup, for instance. You don't have to give them a whole vial. It's easy to find these oils, and then the notes that we'll issue along with this little discussion will tell you where you might be able to obtain oils. You need to be a bit careful. You can get these all over the place online. Some of the oils that are out there are not the very best quality oils, shall we say. For instance, when an oil is made to be ozonated, it needs to be dried first. Otherwise, it has a big moisture component, and that will generate acids and other things like ketones that are going to make it sting more and not last as long. Otherwise, these oils last essentially forever if you don't mistreat them by overheating them. Years. So don't worry about putting these in the refrigerator. If you want to put them in the refrigerator, it's totally fine. It will make them stiffer, and maybe you like that consistency for easier use. But there's no absolute need to refrigerate them. Can I have one of those little gizmos?
If you put it in the refrigerator, though, all it's going to do is melt when you put it back, like into your nares.
Yeah,
so
of course. That's what it should
do.
That's exactly all it should do. Now, you can also use the ozonated oils successfully by swallowing them. Some people just eat it. It tastes fairly nasty. It's more than what I would call an acquired taste, but you certainly can eat it. For instance, people have been doing this for years to manage Helicobacter for ulcers. But an easier way is to use them in an encapsulated form, and there are two ways of doing that. I'm not certain which is best. We get systemic application of the ozonides in these oils. But the question is, should we dissolve them first in the stomach and absorb them there, or further down in the intestinal tract? If you use gelatin capsules, the capsules are going to dissolve before they get to the duodenum, and maybe it's going to be better to use enteric coated capsules so they dissolve further down and you get better absorption systemically. We just don't know. I think if I had a choice right now, I'd look at enteric coated capsules, but that's only a guess. All of this stuff we're talking about, we just don't know specifics on coronavirus. And the only way to find out is experimentally. Otherwise, you got to go with what we know best for lots of other disease states. We also sometimes make up these ozonide-containing oils in a form that can be used as a suppository. For instance, we know there's good systemic absorption of these oils because we have some very nice data on AIDS virus, HIV virus, by using suppositories from data obtained by Julian Holmes in South Africa. And that may very well be a good way of applying these oils. These are ozonides, remember. It's not ozone. You're not dealing with the ozone gas per se. It's ozonides. But in point of fact, when we put ozone into the body, it turns into ozonides essentially instantaneously. And that's the real chemical messenger that goes about doing much of the stuff we see with ozone. So that's the first thing I think we can do with ozone in the dental setting. And there are different types of oils. I would say that they're really closer to each other than they are different. The strongest might be evening primrose, hemp, and sunflower, and then you get the somewhat so-called less strong oils that contain lower levels of ozonides, like olive, jojoba, avocado. They're generally considered gentler, but they may be entirely adequate, any one of them, in this particular application. So I wouldn't make a great deal of differentiation. I don't think you need to worry. Get some oils and start using them immediately. Certainly I would use this as a preventive measure. Once you've got an infection, obviously, you can continue to use them and should continue to use them. And there are lots of other things that you can do, but the oils can be used as a preventive as well as a treatment modality for any kind of a viral infection, or for that matter, a bacterial infection. The other thing I should mention about oils is that it may very well be that some of the morbidity and mortality consequences of coronavirus have to do with lung infections. We certainly know that people die from pneumonias. The question is, what's causing the pneumonia? Is it simply an effusion of fluids as the vasculature is attacked? Or is it secondary infection, which often, if not almost always, comes down from the mouth, particularly with periobugs? So we certainly know that from many studies that have been accomplished in nursing home settings. So it may very well be that we should also be thinking big time about oral hygiene, particularly if somebody gets an infection and is in the hospital. Hospital oral hygiene is notoriously execrable. It's terrible. And so somebody's got to apply these oils. The best way I think to do it is with these little micro brushes, and you just run the oil through the micro brush and then just rub it between the teeth. You know, things like this kind of a little micro brush. There are many types of them available. Some come in different sizes and might be appropriate for people with different kinds of spacing between their teeth, and some are just one size fits all. But get the oils in there, get them down into the perio pockets all around the teeth, spit out the excess. You only need a tiny amount. One zip of the micro brush through the oil is enough to do the entire arch of the teeth. You don't have to have a gallon of the stuff in the mouth. It won't hurt you if you do. But the point is, if you want your patients to continue to use the stuff, have a minimum impact of taste, so the tiniest amount. And you can actually describe this as kind of a nutty taste if you don't have a gallon of it in your mouth. Some people even put this in trays and squish it down around the teeth. I don't find that that's all that necessary. I think it's wasteful of the oils and really overkill. A tiny amount is all you need, and from all of our observations in perio, it works remarkably well to control the perio, so we're not dealing with secondary infection that's coming from the mouth. Next order of business, I think, for a dental office with ozone equipment in the office is to be making ozone water all day long. There are lots of ways of doing it. You can see we're doing it right here. If you look carefully, you'll see some tiny bubbles coming up from the diffuser stone down in the bottom, and all that's happening here is that we've got a bottle of oxygen over here with a regulator on it, and that feeds the ozone generator, which is turned up to max. It's running at a very slow flow rate so that we have the highest concentration of oxygen coming into the water, because the amount of ozone that dissolves in water is directly proportional to the concentration of the ozone coming in. Now, having said that, you want to get your water up to speed as rapidly as possible so you're not wasting time in the office. The highest concentration comes from, in fact, running this regulator at its lowest speed, which in normal cases is about 1/32nd liter per minute. That's your highest concentration. On the other hand, to get the water up to maximum concentration, it's more efficient to run that regulator at a couple times higher flow rate in order to get the maximum number of ozone molecules into the water rapidly. So let me describe it. When you first start the water, you start it at 3 clicks on. That's usually 1/8 liter per minute. You do it at that rate for 5 minutes. Then you turn it 1 click more left. That'll take you to 1/16 liter per minute. Again, higher concentration. And then after another 5 minutes, then you turn it down to the lowest flow rate, which is 1/32nd. That will give you a sharper curve coming up to the max. But in any event, no matter how fast you get there, sooner or later you get to a max. And that is directly dependent on several factors. Numero uno, the concentration of the ozone coming in there in the first place, but it's also extremely dependent on what you're ozonating. If you're ozonating tap water, it's got all sorts of gunk in it, and you're going to have to knock out all that gunk first. So the curve's going to look very flat in terms of the actual ozone levels until you finally knock out all the junk that's in the water. Then the curve will come up. On the other hand, if you start with distilled water, the curve goes up much more rapidly. And the last thing that is pertinent is the temperature of the water. The colder the water, the higher the ultimate level of that maximum saturated level of ozone. At room temperature, for instance, you may get as low as 5 micrograms per milliliter in that ozonated water. On the other hand, if we're using cold distilled water at almost freezing, you can get 20. So that's much stronger. Now, why would I want the strongest levels of ozone water? Well, for instance, I'm going to go out and put that ozone water in a simple spray bottle and go around and spray all my counter surfaces, spray the chair, spray your hands, spray anybody who walks by, because that will knock out the maximum amount of viral load. On the other hand, once we have this water made up, it does not have to be that strong in order to manage the dental unit waterline microbes. A lower level, even 1 microgram per ml, is quite efficient, used long term in a dental unit waterline. That's for normal situations where you want to control what's normally in your dental unit waterlines. which could be thousands upon thousands of colony forming units otherwise, even with all the other gunk that we put in, the tablets and whatnot that you put in to these dental unit water lines to control that. On the other hand, if you're using ozonated water in your dental unit water lines, the colony forming units could be close to zero, if not zero, repeatedly and controlledly. The other thing is, though, we're thinking about doing something therapeutic with this water. So there you may consider putting the max strength ozonated water you can make into your dental units.
Kind of like a shock.
A shock, and certainly I would do that when you're first starting to do this. If you have not been using ozonated water routinely in your dental unit water lines, you better think twice about it. Because when you first put this in, it's going to kill all sorts of biofilm that's been lining those tubes, those little microtubes in all of our units. And what you'll see is kind of little snakes coming out, tiny little brown snakes coming out of the handpiece hoses when you first start to do this. So you need to be pretty careful about that. And if I were going to start doing this, I would start like on a Friday, presuming you're working at all. Start on a Friday, put max strength ozonated water in and run it through the lines for a minute. Then come back later, put fresh, high concentration in there, run it through all of the lines for a minute, including the water spray. And then you do that repeatedly several times a day during the entire weekend. So back on Monday, when you go to use your $1,000 handpiece on these lines, you're not going to be pumping little tiny worms into them that's going to clog up their tubing. But once you've done that, you don't have to do that ever again, presuming you're doing this relatively routinely. And there, just to control dental unit water lines, you can put maybe a quarter or a third of the high concentration water in that bottle. The rest you can fill up with regular distilled and then continue your normal work. However, if you think that that's going to be therapeutic, I think you've got another thing coming, because ozone doesn't stay in that water really long term. And you'll see a relatively rapid decrease in strength. So if you start with, let's say, a quarter or a third of the bottle, full strength ozonated water that you can make, by the end of the morning, it's decreased enough that it's not really strong enough any longer for maintenance of the water lines. There you've got to think about coming in the afternoon, putting in fresh. So maybe twice a day, refresh the concentrated ozone water in the dental unit water line bottles. But you could put high concentration ozone water in there so that when you spray in somebody's mouth, it's going to have a therapeutic effect. It's not just for the water lines any longer. However, if that's what I wanted, I would get fresh ozonated water for every single patient. And the first thing they're going to do before they even sit in my chair is rinse their mouth with a couple ounces of ozonated water, usually 30 seconds. We'll tell them to rinse around thoroughly and swallow it. And if you don't want to swallow it, you don't have to swallow it. It's good for you. We all drink it all day long. But if you don't, spit it back in the cup, and we'll just toss the cup. And so that way you're going to lower the levels of things that we're going to be blowing out in our airstream and their airstream. And in point of fact, the front desk's airstream, as we know from bacterial studies and immunity studies done in the dental office, because this stuff that we aerosolize gets everywhere. So you can significantly reduce that by thoroughly rinsing the mouth before you even start. And then throughout all my procedures, I'll be using high-strength ozonated water, and it doesn't have to be very fancy. You can use a curved tip syringe, you can use a Luer lock syringe, just stick a piece of hosing on it, and you can squirt it any place in the mouth where you're messing around. That way, you're going to have the highest concentrations available. The other thing I would do is for all hygiene procedures, the little bottles that go on their ultrasonics should be high-strength, high-concentration ozone water, and you do that individually for every single patient, fresh. Because it's just not going to be strong enough, especially when it goes through the ultrasonic tip. That takes a big hit on the ozone. You want that as strong as you can make, so that whatever you're blowing out in the airstream is very likely disinfected before it gets to us.
A couple things here, Bill.
Yeah.
First off, in making the ozonated water, one of the things is, you know, the timings. So can you just let that run at the lower concentration and it just takes a longer time to get it up to that concentration?
No, if you had a low concentration, it's going to get to an asymptotic level.
Well, I meant
appropriate.
the flow rate.
The flow rate, yeah,
rate.
oh, absolutely. So if we started, let's say, at the slowest flow rate, in other words, max concentration, it's going to take 20 minutes for an Erlenmeyer flask like this of distilled water to get up. We know this very clearly from all these measurements. It takes 20 minutes to get up to max.
Because that may be easier for a dental office.
Of course.
Because you can set it and forget it.
Yeah,
the difference
exactly.
between that 10 minutes may not be critical in the dental office setting.
Now, for us, we let it run 24/7 during the week. We don't even turn it off overnight. You could. Incidentally, though, if you do turn it off overnight, you have to remember that it's hot gas inside your ozone generator, and that's going to generate a vacuum when it cools. So you got to be sure that when it cools, it's not going to suck water back from the bottle into your generator and fry your generator. So either this bottle has to be significantly lower than your ozone generator, or you've got to take it apart or
clamp it
or turn it off but let the oxygen flow at 1/32 liter per minute. How much are you going to lose overnight?
Not much.
Nada.
And even a hemostat crimping the,
yes, but you will forget. I guarantee you'll forget. So the easiest thing to me is just leave it on. But if you do leave it on, just at least leave the oxygen on and turn off the generator if that bothers you. But you're using less than what your light bulb is going to be using. The easiest thing to do is simply mount your generator about a foot or so higher than the water bottle. That way, if you do shut it off and it's still hot, it's going to suck back water, but water can't go all the way up to the height of the generator. That's the easiest solution, and it's one of those things you don't have to remember to do. For instance, in scaling, don't forget you can use ozonated water to irrigate with. Squirt a little ozonated water, scale. Squirt a little ozonated water and scale. My preference is that you don't use a lot of hand scaling, if any. My preference is that you use ultrasonic with high concentration ozonated water. That's the best way to debride that area, decontaminate the area, and even if you do leave a little bit of calculus there, that's not the end of the world. Why? Because you've decontaminated it with the ozonated water. And of course your patients, if they're compliant, can be doing this at home using little micro brushes with ozone oil on the micro brushes day in and day out. Once a day is usually enough.
And there's nothing wrong with putting a little ozonated oil on the scaler.
No, yes, you certainly could do that. And you can use ozonated oil, incidentally, in debriding a root canal, but if I was going to do that and close the root canal permanently that day, I would use some absolute alcohol to clean it off the walls before trying to obturate the canal. Otherwise, if it's more than a week, it's gone, it's absorbed, and it's done its thing. You don't have to worry about it. Remember, you can wash your hands and you can wash your instruments in high concentration ozonated water. You can put it in the ultrasonic, for instance. Obviously, the jiggling and the temperature of the ultrasonic instrument cleaner is going to do damage to the ozone, but it still is a very powerful way of cleaning those instruments off. The good news is that viruses are very weak and you can kill them in microseconds if the ozone gets to them. You can also use your ozonated water to gargle with, and you can snort ozonated water. Probably the easiest way to do it is put it in a little syringe with a tube on it and stick it up your schnoz, hang over the sink, and blast your naris out with ozonated water and let it run out the other side. It's totally fine to drink the ozonated water. People drink it by the quart every day. Certainly under these circumstances, it would be my recommendation, if you can get some ozonated water in, when you get a chance, to do it all day long. Any questions about ozonated water?
No, it's pretty simple to get it started in your office. It's probably the easiest thing to do and make rather than oil. And
no, I'm not suggesting you make the oil.
Yeah, so but it's definitely easiest way to do it, and it's got multi-uses.
Yeah. I'm conflicted here because I think many dentists could go out and get ozone equipment and jury rig it one way or the other and figure out how to be using it in their office. I think I need to be clear that my comments here are more directed to people who are actually using ozonated equipment, ozonating equipment in their office and have had adequate training already. I don't think that a presentation like this can get you satisfactorily and safely up to speed using ozone equipment in your office. You've got to have adequate training. Oils, I'm not too worried about at all, but the gas is a different matter. There are hygiene and safety issues that you have to come to grips with. And so these comments are more directed to people who are actually using ozone in their office already. This is a simple and fast way of making ozonated water. But if you take a look over here, you'll see a little silver container. And that's to remind me to talk about several other units that are being marketed now for making ozone water. And for those who don't have ozone equipment in their office, this may be a good option because you don't have to know much. They're safer to work with without any training. And there are several different types. And basically they work on what's called a PEM cell, P-E-M cell. And what that does is electrolytically, just leave that. Yeah. Electrolytically, they take water and they split it up into H and O because you got H2O in there. So they take the hydrogens and throw them off, and the O's remain. The energy of the electricity that's gone into separating the H's and O's is enough to make ozone. The same sort of thing that happens is in an ozone generator tube, where we put very high voltage electricity across the oxygen stream going through this cell, and it rips the oxygens apart, the oxygen molecule, and ends up making O3 instead of O2. The same thing happens there, but it happens electrolytically, quietly, and there's not much you have to do but plug this thing into a source of water. Now, there are some issues. The cleaner your water source, the better it's going to work. These things may not live very long if you plug them into a crummy source of water like city water. And there are ways of testing your city water to find out if these cells are going to be usable. And in the materials that I'm going to issue with this course, I will give you some information about what sorts of items I'm talking about here. This is just representational of the kinds of things that are available. They are not inexpensive, but they also don't require you to have much training, except maybe plumbing, to get somebody to hook these things in. You might need, for instance, to make RO water in your office in order to feed these things safely and properly. But that's a good way of making, I would call it moderate strength ozonated water, as far as we can tell. Therapeutic level strength ozonated water. And by that I mean anything over about 8 parts per million, 8 micrograms per ml. That's therapeutic level. I would use that in endo, for instance, rinsing out for perio. The stronger the better, obviously, but the one thing that's nice about these units is that it makes unlimited amount. You just turn on the water and it comes out. You don't have to feed them with oxygen. You don't have to mess with this sort of a system. You don't have to be pouring it into your bottles and diluting. You just use it straight out of the machine and put it in everything. Have your patients rinse with it, drink it all day long. And while I'm thinking about it, some even generate hydrogen. And hydrogen, under these circumstances of coronavirus, may also be therapeutic. Here's a little hydrogen water maker, and I would be drinking hydrogen water all day long too. You might be able to see the tiny little bubbles forming. Now, if I didn't have an Erlenmeyer flask and I decided I was going to have to make ozonated water under this particular type of an emergency, what could I do? Well, you don't have to have a diffuser ball. What's nice about this is it makes tiny little bubbles, and the finer the bubble structure, the faster the ozone gets into the water. But in point of fact, if you had no diffuser ball at all, and you just had bloop, 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 ozone coming out into the water, even in a cup, you would have ozone water. And you could just do that on your counter, obviously, with adequate ventilation or a fan blowing the excess ozone away. You'll notice here that excess ozone, which is in fact coming out over the top of the water, is going into this little destructor unit, so it's not coming out into our airspace. Incidentally, this particular type of flask has been designed so that we can get the ozone water out through a secondary tube here, rather than having to open the cork, spilling out the ozone gas into our working space and pouring out the ozone water. And you can also actually refill it through that very same hose. So instead of going the old way where you open the top and have to be worrying about ozone for your staff or yourself, you just use this and there's no ozone gas coming out. If you are in fact, though, making your ozone water in a small container without this kind of a system, when you pour out the ozone water, you're also getting a layer of ozone gas floating over the top of the surface. So before you give that to a patient, you tell them to just blow it off, so that when they go to drink it, they're not sticking their schnoz into a whole concentrated bunch of ozone gas. What's that going to do to them? It's going to make them cough. That's about the worst thing that could happen. Other options for ozone in the dental office involve things like ear insufflation, getting ozone into the head and neck, especially getting it into the body secondarily. First things first, easiest is probably ear insufflation. Insufflation obviously being the application of ozone gas to a surface. And so here is a device that's been designed specifically for that. This tube connects directly to the ozone generator. And when we give this to our patient, we'll put little covers over the earpieces. You can do that by a piece of dampened cotton gauze. We have these little sleeves, and they're wet with ozonated water. Ideally, could be just plain tap water if that's all you've got. The idea is to moisturize the flow of gas coming over the eardrum, and also to allow escapement of the gas rather than shoving an earpiece directly in the ear canal, because that's going to build up pressure, and regulators put out 50 psi, and you don't want 50 psi blowing against your eardrum. So this allows the flow of the gas out as well as moisturizing the flow. I don't think there's any need to run this through a moisturizing bottle of water. I think that's counterproductive. So in any event, this goes directly to the ozone generator. We wet this, and we usually give this to the patient. Say, you go ahead and put that in your ear. If you notice, those earpieces are angled slightly forward. So that's the way most ear canals sit in the human, if you want to orient your stethoscope. And now we'll crank up the ozone generator. We generally use it at its max. In other words, turn it all the way up, low flow rate, and gas just flows out. The question is, where's the gas going to go? In the simplest form of these things, which you certainly could set up yourself, it's just going to go out around your head and neck and blow in your eyes and make your eyes burn. It's going to smell. So many physicians' offices are doing this. They just put a fan in front of the patient, blow the stuff away. It's diluted in the air of the room, and if there's a big enough room, it's just not a big deal. You usually sit there for about 15 minutes, allowing the ozone to flow into the ear canal and over the eardrum, and there's enough vasculature there to absorb the ozone into the head, where the highest concentration is going to be, but it goes to the entire rest of the body, but just not as concentrated. So what we'll do in a dental setting, though, is that fortunately we have a saliva ejector. So there's a secondary tube here that connects to these little things that look like rabbit ears. And that just goes to the suction. So the gas will come out, be sucked up, and then go down the saliva ejector. It's totally fine to put that into your suction system. It probably keeps it cleaner than it would otherwise be. There are other versions of this that are based on the same idea. Suction around the earpiece, simplified. There's some very sophisticated versions. This is a simpler version, but the simplest, obviously, is something you could set up yourself, just hooking your generator directly to a stethoscope. Incidentally, if the tubing is latex, it's not going to last very long. Unfortunately, most of these things are not latex anymore. They're ozone-resistant type silicones, and so these tubes just do fine. Some of the generators make some noise, so sometimes they'll set these things up with a little muffler so that you don't hear the whistling of the generator. But If your alternative is croaking from a coronavirus or hearing a little whistling in your ear, I'd take the whistling in the ear before I had to worry about the muffler business. Clear enough?
Clear enough. You're loud and clear.
Now, was that uncomfortable?
No, not at all. It just, it takes a little getting used to. But I've had worse with my AirPods in my ears for
exactly.
a couple hours.
Most people are used to that. Now, it's going to feel warm at first. You should advise the patient it's going to feel a little warm initially. As time goes on, they may taste a little bit of the ozone flavor in the back of their mouth. That's totally fine and to be expected. How often would I do this? If it were me and I was in a risk situation like with coronavirus, I'd be doing this a couple times a day. I don't think any of these things you could do too much. It's just a question of what's convenient in the timetable of your office.
And again, that's about 15 minutes, Bill?
Yeah.
So, Bill, what's the recommendation for doing ear insufflation when, let's say, we've got a patient that we're not so sure about, or just basically at this point any patient, because we have to be taking, adequate measures to ensure the safety of both the patient and ourselves?
Okay, I think any patient who comes in the office is a good candidate to be doing ear insufflation under any circumstances, let alone the era of coronavirus. It's good for them and it's good for us because we're going to lower the infective load that they're bringing to us. But if somebody, I'm talking about preventive now, if somebody starts to get symptomatic, things ratchet up significantly, and then I'm going to be doing these things maybe longer or more frequently. As I say, I don't think you can do it too much. We've done this, for instance, for TMJ and things of that nature for 45 minutes with impunity. So I would do it longer if it's convenient.
It's not a bad idea then for during lunchtime or whatever for the doc to just put it in their ears.
Not just the doc, the whole staff. You see all lined up with your little ear insufflations going.
It just trying to keep yourself safe.
Yeah, and it's very obviously easy to do it with ozonated water. You can be rinsing, gargling, swallowing the ozonated water throughout the day. Everybody can be doing that, snorting once in a while. Very easy to do. Obviously, this is a little bit more complicated because it ties you down, but it takes 2 seconds to drink the ozonated water.
Do you get the same effect whether you're drinking the water or whether you're, putting it in your ears?
We don't have enough data to say. We know all of these things are good, but we don't know exactly how they compare in terms of specifics. And they may have slightly different modes of action. So I think they're cumulative. I don't think you should just do one of these things if you can. It's belt and suspenders time.
Got it.
Hit it with everything. Now, let's talk about the next thing that's relatively easily done if you've got some ozone training and equipment. And that is doing Ozonide inhalation. We talked about the oils, and the oils, as you recall, are simply ozonides. Here we're going to be making ozonides in, let's crank that up a little bit. That's good. In an organic oil. In this particular case, it happens to be extra virgin olive oil. The thing is, when we start doing this, there's no ozonides in there. We're going to be breathing, as Marty has set up, these ozonides through a nasal cannula. So we're running the ozone into the oil. It's generating ozonides in microseconds, and there's no ozone coming out here. Marty's not sitting there breathing ozone gas, believe me. He's breathing oxygen. You don't do that more than once. He's going to be breathing ozonides that are being driven by ozone gas bubbling through the ozone oil. But look how slowly this is coming out. This is what you would do to get high concentration ozone water. But there's a night and day difference about making ozonides in the oil. So when we're making ozonides to inhale, we want a much higher flow rate. So go ahead and turn that to the right, like 4 clicks. So what you're seeing here is a bunch of oxygen coming out, and we're making a bunch of ozonides much more rapidly than you would with high concentration ozone coming in here. It is not the concentration of the ozone coming in that makes the difference. It is the total number of ozone molecules that you're putting into that substrate that makes the difference. So even though the concentration coming in here is lower, the number of ozone molecules you're putting in is much higher because you've changed the flow rate. Again, the ozone generator is up to max. The flow rate is much higher. And there's usually a sweet spot on most of these ozone generators around 1 liter per minute or so that's going to give you the best bang for the buck with the oxygen you're putting in here. The more oxygen flow, the more ozone molecules, the more ozonides you're going to generate, and the more you're going to drive up the hose. And remember, you breathe, what, 4 to 6 liters per minute. So this is not anywhere near as fast as you're actually breathing. Now, the thing is, when you start, there's no ozonides in this oil, right? So we're going to kick-start that ozonide inhalational process by taking a blob of ozone oil and putting it in there and jiggling it up so it's dissolved in that base oil before we even start. That way you're going to have a bunch of ozonides that you're already going to be able to inhale as you're doing this. Otherwise, it's going to take a long time to slowly ramp up. Now, you can continue to reuse this oil easily for a week, maybe longer. What's the limiting factor? Well, obviously, you're not using the same one of these on everybody.
Right.
But what's the limiting factor is that as you do this, you are in fact making ozone oil. And so as time goes on, you're going to get more and more and more ozonides accumulating in here. It's going to get more and more viscous. Now, if you notice on the top, we have a little bit of foam. Well, that foam can get exorbitant and go all the way up, and then you're starting to drive foam right up somebody's schnoz. So you got to pay attention. As time goes on, as this gets thicker and thicker, you're going to have more and more ozonide molecules in there. That's when you want to dump some of this out, and you can probably use it therapeutically because you have in fact made low concentration ozone oil. Probably fine for putting up your schnoz. But in any event, don't dump it all out. Dump maybe half of it out, put in fresh olive oil, and then the foam concentration is going to go down, and you can continue to use it much more effectively than if you just start from scratch each time. This never goes bad. You can do it for months on months. Now, a couple things. First of all, if you knock this over, you've got gas pressure coming in here. That's going to drive the oil right up and make a mess. So it's a good idea to mount your flask in something like a box of plaster or something so you can't ever knock it over. Number one. Number two, if that stone is ever exposed directly to the air and not underneath the oil, it's going to in fact be putting ozone gas in here, and it's going to force it up somebody's nose. So the stone must absolutely be covered at all times. If you knock it sideways, if the stone is partially exposed, ozone could conceivably coming up here. Now, obviously the patient is going to rip it off and start cussing at you, but you want to pay attention to this stuff so that that can't happen. No exposure to ozone gas. If that were to happen, that's when we'll pull out the powdered potassium ascorbate, chewable vitamin C, emergen-C powder, and you put that under the tongue and it absorbs and it'll help to complex the ozone if somebody happens to start coughing. I have had this happen less than the fingers of one hand after a couple decades. It's not something you have to sit around worrying about, but every room where you're doing anything with ozone, it's a good idea to have a little packet of emergen-C sitting there just in case. Okay, so this is ozonide inhalational therapy. I would probably do this for about 15 minutes or more. As a therapeutic, certainly, but even as a preventive. Again, to get ozone into the body, head and neck especially, lungs, sinuses, great for that. But this is a full systemic ozonation. It is not real high concentration compared to other things that we can do, but nonetheless, this is a systemic application of ozone, although it is wonderful for local issues, especially head and neck and bronchial tree.
Which is where we're heading with
This is absolutely where we're heading. If it were me and I was exposed, I'd be doing this every day. If I started to get symptomatic, I'd be doing this at least a couple times a day, and probably longer than 15 minutes.
And this will work still on the common cold and
oh, absolutely.
That, so,
bacterial infections, sinus infections, which are often fungal, that antibiotics don't touch. So this is a very useful therapy along with ear insufflation to get ozone into head and neck. Can't beat it. Simple. And it's easy to probably set up multiples of these with a simple Y tubing. You can do a couple at a time. Now we're talking about other uses of ozone in the coronavirus issues. If you are stuck having to reuse PPE, personal protective equipment, this is a good time to start thinking about what you can do with ozone. For instance, in reusing a mask. Part of the problem with masks is that they tend to pick up moisture over time, and really after an hour the efficiency of a mask goes down. Now obviously a mask is probably none of the masks are going to be able to actually filter out viral particles, but the good news is most viral particles are on fomites, which are tiny little droplets of water carrying the virus. They will be stopped by the filtration processes of the mask, but only as long as the mask is not saturated, and it's going to become saturated in relatively short order. So either you keep getting new masks or you can reprocess your mask. I think that there are several ways of doing it, but probably the best way is to first ozonate. Put them in a baggie, run your gas in. A minute's worth of ozone gas is going to be plenty. As long as there's space for the gas to circulate around, you probably put several masks into a big plastic baggie and just kind of mush it around so the gas circulates. That will kill anything that's on any fomites that have attached to the mask, but it doesn't do anything for the moisture. However, you want the moisture there so that the ozone can be absorbed and work better. Then, once they're saturated with ozone and sterilized, then you dry them and you just stick them in a little toaster oven or something for a tiny bit of time to warm them up and drive off any moisture. And then I think you can more likely safely reuse these things indefinitely. The other way around I don't think is good. You can dry them first in the toaster oven and then ozonate them. That's going to sterilize them, but it's not going to sterilize them probably as well as if the moisture is there initially. So I say ozonate first, then heat dry to reprocess PPEs. And you can do that with gowns too. Put them in a bag, fluff them up with the gas for a little bit, and then heat sterilize them if you wanted to do that. Another option to get ozone into the body is full ozone gas. We talked about putting it over the eardrum, but think of the surface area of an eardrum. It's tiny. And we're not talking just about the eardrum. You got the entire length of the meatus there. That's also going to absorb ozone into the circulation. Nonetheless, that's a tiny surface area. It's not super vascularized. But think about the floor of the mouth, for instance, which is just loaded. I mean, just think why you put your nitroglycerin tab under your tongue. Loaded with vasculature that can instantly absorb something transmucosally. So with ozone, it's a good option to think about making an ozone tray that looks like an upper tray, but it's inverted and goes under your tongue. You feed the ozone into that, and it covers the entire floor of the mouth and can be absorbed by a much greater surface area. So you're getting a lot more ozone into the head and neck doing that. And I say head and neck, but it's in point of fact, it's the whole rest of the body. You are doing a whole body ozone treatment via the floor of the mouth. Now, I'm a little leery about talking about this, but some people don't even bother with the tray and suction and all that so that you can get the ozone out of there. What they will do is train the patient first and then teach them to put the tube of ozone gas in their mouth. Sometimes we'll connect this to a saliva ejector just for more convenience to aiming it around. But you put the whole tube of ozone gas in the mouth and close your lips over the tube. Breathe through your nose. Are you breathing through your mouth at all?
Mm-mm.
I am not going to tell you any jokes. I don't want you laughing while I'm doing this, because in point of fact, if you screw up with this technique, somebody's going to take a honking whiff of ozone, and that's going to make them cough, and it can be problematic, especially if they're asthmatic. So we don't do that. So this is something I'm leery about talking about. If you're going to do this, you want to have plenty of practice sessions first, so you're guaranteed that your patient's going to be compliant and follow your instructions to a T. If you're guaranteed by just your practice session without any ozone that they can do that, then you give them, it could be multiple minutes of ozone with breaks in between. As long as they can keep their lips closed, breathe through their nose, you can do this for an hour. But usually it's done at a slow flow rate. So after a minute or two, they're starting to get some volume in their mouth. So that's when you take your high volume suction, open your mouth, and now it's safe to breathe. You always have your suction right here, no matter what they're doing, and they're perfectly compliant. You're ready to go. If somebody screws up and they start to talk or ask you a question or whatever the heck they think about doing, as soon as you open your mouth, that suction goes there. High volume evacuation. So that's full mouth ozonation. I think it's more controllable if you think about doing the floor of the mouth trays. Obviously, you're going to have to make them, and there's some hassles in going through making a tray to fit the floor of the mouth. We don't have out-of-the-box trays for that at this point. There are lots of other ways of getting ozone into the body, some of which are rather sophisticated. For instance, rectal ozone. And I'm not going to get into a lot of details, but most of the time we'll use a concentration around 40 micrograms per ml, starting with around 200 ml. And most of the research is showing now patients don't have to have an enema before doing that. You don't have to have an enema before doing that. Ideally, you evacuate first. But what you're doing is making a bunch of ozonides there, and those are absorbed through the mucosal tissues of the digestive tract. So that's the key. Get that in there. And it's similar in some ways of using a capsule of ozonated oil or a suppository of oil, because that's what those oils are. They're a ton of ozonides. So you make the ozonides, they're readily absorbed into the mucosal tissue. Now, depending on their orientation, some of your patients have other orifices that they might be able to use. We talked about mouth, we talked about rectal. Patients who present with vaginas can also do vaginal. I'm not suggesting you do this in the office necessarily, although for yourselves is another matter. If you were going to have your patients do more systemic approaches, you can do it in the office, I presume, by filling say an enema bag with the appropriate concentration of gas and give them the bag, and they either go into the lavatory and do it for themselves or they take it home. Now, if they're going to take it home, you need to figure out how long it's going to be before they get home, because obviously the concentration is going to go down. So we figured by about a half an hour, the concentration of the gas has gone down about a half. So it means if you're going to have somebody who's got a half-hour transit time, you give them 80 micrograms ozone. By the time they get home, it's down to 40, and then they can go home and do it for themselves. Otherwise, they can do it in the lavatory in the privacy of their own stall. You will probably find, along with this, the notes for this discussion, a video of me getting direct IV ozone. It was shot by Mike Maroon at, I believe, an AAOSH meeting a while back. And basically what we're doing is putting medium concentration ozone gas directly in a vein. This is not something I think that you are prepared to do even if you've been using ozone in your office for some time. A, you need calibrated equipment so you know precisely the concentration that you're applying. And B, there are lots of subtleties that are requisite to understanding to be able to do direct IV ozone. But having said that, very shortly we're going to have a webinar training session on how to do direct IV ozone, presented under the auspices of Ozone Without Borders by Howard Robbins and Robert Rowan, who have done literally thousands, in fact hundreds of thousands of direct IV procedures. Robbins alone, easily 350,000 direct IV procedures. So these are guys who have got tremendous experience base, and they're going to do what we hope is an effective training on how to do DIV yourself. This is something I think many dentists could use. For instance, if you're dealing with head and neck infection like perio, DIV may very well be a good venue to get a better level of ozone into your patients to really deal with problems from the inside out. Some of our dentists are even using heavier duty equipment to do multipass ozone, where you take out the blood, you ozonate it, and you push it back in, take out the blood, ozonate it, push it back in. That's hyperbaric multipass treatments. That again requires serious training. On the other hand, if you've got somebody in your area who can do these things for you, it'd be really worthwhile to hook up with them and have these procedures done for your patients or for yourselves, particularly if you're coming down with something. And that pretty much concludes what I wanted to talk about directly vis-a-vis ozone. I did mention hydrogen, and I think there are also some nutrients and supplements you want to consider when you're dealing with infective processes, especially resolution of inflammation. For instance, ingesting some immunoglobulins, PRP, proline-rich peptides. These things come in powders and sprays that you can get. Beta-glucans, another very good way of repairing damaged cell walls, which is a key to bouncing back from infections like these. Vitamins D and K2 that goes with the D to improve your body's resistance to infection. It's not just for calcium balance whatsoever. Mushrooms and things of that nature to improve your intake of mucopolysaccharides that again are necessary for repairing cell walls. Managing inflammation via curcumin and sulforaphane as well, I think are worthwhile adjuncts. And hopefully we'll have more to be said along these lines, but I want you to keep that in mind as these events roll out. Again, there are going to be some informational pieces issued with this little discussion, so make sure to take a look at them. I'm happy to handle your questions via the AAOSH discussion group or me directly, WMDome, D-O-M-B, at Verizon.net, William Dome at Verizon.net. We're all in this together, and I think we've got to work together to get out of this. Thanks a lot.